Today I am presenting successful excision of 4 complex pelvic muscles robotically. It was done in our hospital in Hyderabad. We got 2 hospitals, one in Gachibowli and Hyderabad. Now, in this hospital we do the robotic surgery. But this is around 15-year-old hospital, this is 35-year-old hospital. Now, the first case is pelvic sarcoma, a 44-year-old man presented with there was a large mass space of in the pelvis, 8.3 into 5.8 into 6 centimeter, probably from prostate. It is not clear because such a large SOL, we don't know from where it has come. And MRI showed large heterogeneous soft tissue, neoplasm in close relation to right lobe of prostate. It was compressed. And coordinated biopsy showed spindle cells in bundles with myxoid stroma, probably low-grade myxofibrosarcoma was the way of diagnosis. You see here, this is the urinary bladder, this is the swelling, and this is the rectum. So it is between bladder and rectum of the cricket ball size. You can see in multiple sections here. It's a big tumor which has got solid and cystic components. You can see the variation in the density also. So we were surprised such a big tumor has caused very clinical symptoms. And this is a zoom in picture where you can see this is the round on one side, and in the later view it is oblong. So a large tumor between bladder and rectum, and this is a patient. We have decided to take it down by robotic surgery because the area is very deep and inaccessible, and it was done in under general anesthesia. The patient was induced, and then we have used 3 arms for this patient. This was a photograph. This is a photograph of the tumor itself. So bladder is in front, rectum is behind. You can see the video where we are actually trying to peel off the superficial layers around the swelling because we don't know from where it is arising and with what it was connected. So separation of mass between bladder and rectum was the main thing. We have done line and sharp dissection. We have to be careful not to injure bladder or rectum because it was averting between the two, and there was a little space between 2 of them. Now, this was a large tumor which was back and then taken up by from the camera board. Within 3 hours of surgery, there was good recovery. The next day, he could walk. Was discharged on the 3rd day. There was no drain in the first 3 days also, and he is doing well even now. The histopathology showed biphasic population with predominantly spindle cells interspersed with glands showing mild to moderate dysplasia. So, and it was a spindle cell mesenchymal tumor of mixed artery. It was a benign tumor. So this patient is all right 4 years later also. Now, the second case is not out. Second case, there was a young man who had a lack of secondary sexual characters and treated for hypogonadism, testosterone injections when he came to us. He had occasional superficial discomfort and BMI of 31, and his voice was feminine, and he didn't have erections or nocturnal emissions. Since there were no secondary sexual characters and female cells were average, there was a right inguinal testis which we have actually done the orthodoxy. His testosterone was very low. So the chromosome karyotyping done showed that it is a normal XY, and ultrasound showed 15 into 10 into 12, 60 region in the pelvis, a piriform shaped SOL in the pelvis of between bladder and rectum. It was quite a large one, and the shape itself was suggesting that probably it is something related to the uterus, being the location also between bladder and rectum. It was 16 into 13 into 11 centimeter. It was both walled and homogeneous fluid collection inside. It was not infiltrating. It was just a space of upper region between bladder and rectum. He is a man with abdominal fat, no chest hair. This is the testis. The right orthopexy was done. And now coming to the swelling, what we are talking about, you can see here. This is the swelling. This is the swelling. You can see the piriform shaped or oblong shaped lesion, and if you see here, there is another one, which is vertical. So vertical from here onwards, this is the swelling, this is the rectum, and this is bladder. So we are dealing with the long and projecting upwards, and robotically to attempted, and it had some connections with the uterine or para swelling adhesions which are removed, and they are not difficult, they were not infiltrating type of thing. It is just adhesions between rectum and the swelling. The swelling itself was cystic, so we have aspirated that. A lot of mucus has come. After that, the dissection has become quite easy. First, we have dissected the left part, and after that, we have dissected the right part. So, after that, we have seen that the tumor is of this shape. The right one is a little bigger, left one is short, and the histopathy showed that it was a Mullerian duct cyst, and after post surgery, it is second day. So, Dovinsky system, he is a boy after about 1 year. Actually, we have started on testosterone supplementation, and this fellow has got some secondary sexual characters, and there is no pain. Actually, we didn't have much pain before also, but that dull aching pain was absent, and whatever swelling was there, which they were scared of, it was a benign and Mullerian duct cyst. So, retroperitoneal fibrosis, there was medial deviation of the ureters in the L4, L5 level, which was the plaque was excised robotically. Eventually, we put WJ stent so that we don't ignore the ureters. Excision of the plaque was done, and it was quite easy. First on the left side and then on the right side into the lateral included position. We had to change the position in between surgery. Both sides we have done same time and reperitonealized the ureters. And there was a partial nephrectomy which we have done. There is a small swelling which you can see here. There is a small bump here. This bump is something very suspicious, and we thought it probably is a tumor. And partial nephrectomy was done. You can see that bump here, our last lesson. This bump, whatever bump is there, that's a small tumor which we have excised robotically after taking control of the hilum. And since it was not distorted the critical system, it was done easily, and we excised the entire tumor. And then 4 years later, it's doing well. The hilar dissection was done carefully because there were no lymph nodes, there was nothing significant there. So robotic surgery is a wonderful surgery for difficult and complex pelvic tumors where they are inaccessible or quite large and the anatomy is not clear. Such patient is quite comfortable for patient as well as surgeon also. It is here to stay, and 3D visualization helps us to dissect it with more safety. Thank you.
So good correction of cases. And is there an undecided testis in the second case what you have done?
Yes, sir. It was invalid.
It was invalid. One side.
One side only. Other test is other side. We had normal.
So its androgen profile was fine, or there was a PDF?
As one is like it was serum testosterone 117.
Okay.
117 nanograms. Then normal range is between 180 to 827. So we have continued that hypogonadism, whatever we were taking, and now he got married last 6 months. He says that the function is okay.
So you want to add for HRT one? Is there a role of HRT? That second case is quite interesting because it is an
yeah, we have to take it, sir. We have to take it because other tests is okay.
Yeah.
It is decided normally, but overall testosterone function, testosterone levels are low.
Low. It's okay.
They say that even if one side is undescended, the other side which is normal also is dysplastic or dysfunctional. So that's how the total testosterone is not in the range which we are supporting from outside.
Thank you.